Fantastic.
All right. All right. So we're here today with Dr. David White, scholar, clinician of Chinese medicine, who spent the last 22 years of his practice dedicated to an exploration of the clinical application of Neijing acupuncture. He's the founder and director of the INR, the Institute for Neijing Research, this community of practice dedicated to the exploration of this Chinese medical classic, and has lectured and taught internationally for the last 16 years. So here at ICOM, we're really lucky. We're going to collaborate with David, and we're about to start a 20-month CPD program in February, where we're going to take students through an exploration of the Lingshu Jing. And so what we'd like to do in this interview with David is to describe the journey that the students will go on. And what I'd love to cover is who this course is for, what the commitment is, what the point is, essentially, because I think that's something that people will want to ask is what do they get? What's the effect of it? Why should they come and study? Is it just for their own intellectual curiosity, or are there clinical results that you've noticed in your own practice and exploration of it? So David, rather than me describing the course, maybe I can hand over to you and you can describe a little bit about maybe your journey into
Yep,
Chinese medicine, and then what's going to happen. What are you going to deliver when we collaborate in February?
sure thing. And thank you very much. And thanks to ICOM as well for sort of kickstarting this collaboration. It's
Pleasure.
been well, it's been wonderful so far. We haven't started yet, but it's been
Yeah.
wonderful so far. Um, yeah, so I mean the purpose of this program and the purpose of its name as well, which is Clinical Neijing Program, is to bring sort of the last 2 decades of my own research, but also the work that I've done under, my teacher and the work I've done with the text itself in an actual clinical, practical manner. And I think that's one of the things that's lacking or has been lacking in Chinese medicine. Um, I was going to say in the Western world in regards to the classics, but to be honest, I think in regards to Neijing applications, specifically as a defined style, I think those applications have been lacking in Chinese medicine for a very, very long time. Um,
That's
Going
curious
back,
to me, David, because, could we not all, regardless of where you studied, a TCM or a five-phase school, all of our practice is rooted in the Neijing. So it's kind of what's different. Could we
mm.
not all claim to be classical acupuncturists because the material all comes from this similar source?
Oh, yeah, I mean, you can claim to be it, and many do, but claiming to be it and actually putting it into practice is a different thing. But what I'm talking about is the Neijing, and particularly, I do work with the Ling Shujing more as a sort of unified practice style, and I think that's one thing that is so unique and wonderful about Chinese medicine or East Asian medicine. It is that it is defined by style. So as an example, the most sort of defined and recognizable styles that we people see would be within the Japanese tradition, Toyohari or Manaka, or going through TCM as a style of acupuncture as well, a style of Chinese medicine. Um, and we have, it's very similar to the martial arts tradition. We have family styles or lineages or currents of ways in which things were practiced. In the herbal tradition, the Shanghan Zabing Lung is that sort of the most recognizable, long-standing, and definitely we can call classical style of herbal medicine. And it has very direct roots to particular teachers within that and methodology. And it's quite recognizable from even sort of one lineage of Shanghan Lun practice to another as being of that text, as being of that sort of era of inquiry. When it comes to classical acupuncture, the Nanjing is certainly been sort of taken up more in regards to that particular style and expression of it. But the Neijing hasn't in that way. People use it. I think it's been that sort of source text and reference text for
Mm.
various techniques, certainly for the theoretical foundations of of Chinese medicine. And from that perspective, absolutely, why not say that no matter what we're doing is linked to or is classical medicine. But to present it as a particular, like I said, unified style of clinical practice is something that is has not really been at the forefront of sort of this classical renaissance in Chinese medicine.
And so why do you think that is, David? Why has there been this kind of deviance from what's actually presented in the Ling Jing? If it's such a complete practice, why is it not so alive and vibrant?
Yeah, I think there's a few reasons for that. Is aspects of particularly the diagnostics fell out of favor, which is one of the most vital diagnostics within the Ling Jing is called Wen Chen Ko pulse diagnosis, which is palpation of the pulse at the neck and the wrist simultaneously for specifically Jingmai or primary sort of channel movements. But the other thing is that the way that the Neijing is presented, I have used and I use the term cryptic in the way that it is. It's not that it's cryptic. It's just because it is this sort of collated mixture of various texts, is that it doesn't have the same flow to it as, for instance, texts that came after it. So a good example of that is, again, the Shanghan Zabing Nun, or even as a commentary on the Neijing itself, the Jiai Jing, but by Huang Fumi, was an attempt to sort of categorize aspects of the Neijing more in a clearer fashion.
Just to make it kind of more coherent and more linear in that sense.
Yeah. And I also think that, again, that focus of the text and the fact that, what we're dealing with in terms of the Neijing in our the current extant sort of text we have available to us are not the original ones from the Han. So there would have been aspects lost for some time, aspects added. And then what Chinese medicine was built upon was often the text, but then the commentary on it as well. Yeah. And the commentaries are very important. I have often said that I don't read or address the commentaries, and that's purely because of the way that I was taught and the way that I'm trying to present this material is I am the commentator at this stage. But the commentaries are important. And then of course, as commentaries are built upon, as ideas are built upon, as elements of different ideals of what Chinese medicine should look like, of the impact of different families and styles and so forth, then it starts to diverge a little bit, it starts to change. And some methods get more popular than others. And, over time, the actual sort of essence of that classical text remains, but the structure of it as a system slowly becomes diluted. And I think that's kind of what's happened with the Neijing. So it hasn't taken away anything away from its importance. I mean, everyone in Chinese medicine understands it's such a vital text. I would also say that the weighting of that sort of vital aspect of that text is towards the Suwen because of the theoretical foundations that we draw from the Suwen, and only a small portion of the Ling Shu mainly related to the channel network.
So it's used more for the kind of underlying principles and core stories around Chinese philosophy rather than the granular clinical application.
Absolutely, but principle is what it all is about, and that's kind of what I'm trying to teach within this course. It's what I will teach you. This is a structured principle approach, but what we're using is we're only using the Neijing. We're only using those. We're not working from commentaries. We're not working from any deviation from that primary text, but we're also working with it from a clinical perspective to say that. As we sort of move through the text, we build this understanding of approach that is manifested throughout every line of the text as well. So the principle becomes very, very important. I think aspects of the principle that we use now in modern China, delivering education of Chinese medicine, it is just a very diluted version of that. And so even though, yes, it may be principled, it's not true to the origin of the lens of the authors, if that makes sense. And from that perspective, I think that therefore it is lacking in its approach.
Okay.
Yeah.
So, I mean, what I hear from that is that it's just difficult and it takes time. So that's why people have kind of shortcut it, or they haven't bothered to get into the kind of forensic detail of the physiology of the Jingmai system, because it just takes a lot of effort.
Yeah, I think so. I think that can be part of it. I also think that we have 2 millennia of Chinese medicine essentially built upon texts like these. And so a lot of the work's been done for people. And when the work's been done and the information is easily accessible in many ways, then they don't bother going back to the source text themselves.
Well,
I
especially
think
if you
that's
don't speak
changing a little
Chinese.
bit though. Yeah, yeah. And of course, language barriers are a massive component. But I think that is changing. More people are starting out with learning aspects of the language first. More people are jumping onto reading, and of course the accessibility to translations as well of classical medicine. There's a ton of commentaries now being published as well, which is vital. So, you know, there's just so much information out there. And so I think it's just hard for people to say, well, this is going to be my only focus. I made that decision and I'm going to sort of stick to it, and I really enjoy it and love it. But, you know, we have so much education in Chinese medicine now. And it's to the point of, with being overly educated in Chinese medicine leads to a more diluted clinical practice, because we don't have, again, a structured principle approach to what we're doing. There's no defined element of us going, well, if this is the direction we're taking, then, you know, we know what the result will be. If we make a mistake, we know why that mistake is there. But if you've got a mixed bag of tricks, as I call them, you know, and particularly point combinations and all these sorts of things, or people do it with herbal medicine, and they use that foundation of a classical formula, but then they just go, oh, maybe I should add this on because the patient had this, or maybe I should add this on, and they start modifying. But I mean, modifying of formulas was an art in itself.
Yeah.
And, you know, and there's only a few who are teaching that art properly nowadays. And it comes to the same thing with acupuncture and acupuncture technique.
Well, I certainly know my own practice that, you know, I'm entirely focused on what's clinically effective. So even if I don't actually understand particularly why this combination works, I will throw it
Yeah.
in. And it
Yeah.
feels a little bit messy, but it's not.
Yeah, I mean, I think we all have to go through that aspect of our practice. I think the mess needs to be there, because you know, you have to experiment to an extent to find out what, not only what works, but also what works with you, or what you can work with. And again, there's so much out there. So a lot of people are, you know, going to seminars searching for those different answers and different ideals for that. And what I'm offering with this course is to say, well, yes, here is another answer, but actually it's an answer completely rooted in the source text of everything else, essentially.
As in, there's no interpretation, there's no assumptions that has been made. This is a kind of core
Yeah, yeah,
narrative.
that's right, that's right. And that's what the goal of making it purely a clinical program is that I want it to be as clear cut, and I want it to be something that from day one that students can start to take away and into their practice and start using it. And they will integrate it, however much I would like them not to. They will integrate it, you know, because
But in this kind of magpie fashion of just, you know, adding little bits and bobs
yeah.
to go along.
But
Do you
no,
think
but
that's kind of
they'll start
okay?
to be able to experience it, and they'll start to be able to see the efficacy of it and see the clear-cut direction they can give to their patients, and to enable change to pathology and those sorts of things.
And
And
have
I
you
think that's
noticed
where the
in,
Neijing, so
sorry,
go
have
on.
you noticed in your practice that your practice is better as a result of this clarity
Yeah,
of diagnosis and intervention?
this these methodologies have formed the majority of my practice time. So, yes, you know, because I you know, I have success in practice. So yes, and the clarity of what I'm doing, whether right or wrong, is there, and only gets clearer and clearer as time goes on. Um, so yeah, I mean, from a clinical efficacy, I find the Neijing methodologies and the Ling Shu Jing methodologies particularly to be so precise in their application, that you realize what you're working with. And the way I'm teaching it as well is that you have clear-cut tools, you have clear methodologies, you have sort of this step-by-step approach to it,
Mm.
and which all sits perfectly on that, you know, original foundation
Foundational
of
principle.
classical Chinese thought and all classical Chinese medical thought.
Okay.
Yeah.
And that's because you teach the energetic physiology of the Jingmai system so that then you can predict progression of pathology, or is that
Yeah.
the kind of clarity that you want?
So really what I you know, a lot of my teaching originated in teaching technique, acupuncture technique,
Okay.
because I started with teaching technique and the pathology associated with those techniques, and kind of reverse engineering going from pathology to technique to understanding physiology rather than physiology technique to pathology, or pathology to technique, because that's what you see in clinic. If you're observing a teacher, you are watching them needle, and you might be feeling pulses, and then you start to sort of bring it together. And if you want to map the idea of what is needed, then it's nice to go, well, these are the signs and symptoms, these are the patterns, these are the pulses, these are the pathological indicators. Okay, now how do we apply and how do we needle that? So to work on those two together was a big aspect of my early teaching, and how I'll teach the 27 needling techniques in this course.
Okay.
But on top of that, for the actual Jingmai component, it wasn't just about energetics of movements and things. Or, we'll talk about that. I don't particularly use it or like the term energetics, but we'll talk about that aspect of it. But again, we're going to be working from the pathology of it. And so understanding the specific disease states of each of the channel complexes that as I call them, or what I call the compass of the Jinglo, which is the entire system, working from the disease states, understanding how the Neijing and the authors of the Neijing perceive those disease states, but then also how they relate to modern clinical practice. Because if you read the text and you might read about a specific disease, it seems very precise in terms of the disease presented and the signs and symptoms that go along with that. But when you start to understand the principle behind the text itself and behind the actual individual chapters or the book as a whole and the system, you realize that a lot of those signs and symptoms are indicators for specific movements or directional manifestations. There's seasonal patterning and all those aspects of the core foundational theory that come to life. And
so as in it kind of signposts you as this pathology is related to the lower or the divergent or the sinews in that sort of clarity that you develop.
Yeah, absolutely. And on that, one of the aspects of what I really sort of hammer into my students there is working with each individual sort of system and layer as individual entities in the whole.
Yeah.
So, if we are working on, our Jingjin and our tendon channels, there are specific techniques and assessment criteria for that. There's a specific technique and assessment criteria for the Jingmai, for the Jinglo and Jingbie, for Lo Mai Lo Bie, for organ-based physiology, for tissue planes, for geographical representation of diseases, for seasonal pathology, and so forth. So that's what we're going to. Particularly the first part of this course is to go through how to identify those through primary diagnostic indicators, which is our pulse systems primarily. And in the Neijing, we have three major pulse systems that we'll be working on, complexion diagnosis and palpation methods that are required to rapidly sort of identify those aspects so that we can work then into our techniques and pathology and then work and layer into our Jingmai and Lo pathology as well.
Okay.
So it's sort of that step-by-step aspect, which I
So
think
the
a lot of
structure
people
starts with diagnostic indicators and then what aspect of the Jinglo that they relate to, and then the treatment intervention after that.
Yeah, in a sense, yes. Yeah. Okay. Yeah. And the way that we're sort of approaching it, like I said, it's to ensure that people have that ability to either, they can mentally or physically, but tick boxes as they go. And when I gave that talk on principled practice, that's what I sort of talked about, the origin of maybe where a disease is, but then also what assessment criteria there in terms of where the disease is located or diagnostic criteria, but then also what is the appropriate intervention? What's the appropriate tool for that intervention in regards to, for instance, the 9 needles and, those sorts of aspects as well. So they all sort of will fall into place, and you'll see, and the reason of teaching it as a sort of a principled approach is that they can take those principled approaches, pick up the text, read any sort of chapter and see the patterning within that chapter, and all of a sudden they have greater clarity of what the Neijing is saying. Because I can't teach 162 chapters of a classical text over 20 months. That's not enough time. So what I'm teaching is the core foundational principle approach. In fact, we sort of linger within those first 13 chapters of the Ling Shu with this course.
Okay. So it's kind of you're teaching how to think so that then you can engage, or you feel confident to engage with the classical text because you know how to interpret it, or you know how to decode what's in there.
That's right. So it is from that perspective, from the Neijing sort of style of approach, it is considered foundational material. But from a clinical perspective, it's absolutely, it's foundational that bleeds heavily into, very complex disease patterning and everything else that goes along with it. So the way I've sort of designed this is that if you are absolutely brand new to Chinese medicine, you could come across and sit in this class and immediately get a completely new perspective, or for them it would be an original perspective of how to approach treatment and diagnostics. But if you're seasoned practitioners, then it's a new perspective, and you go, okay, now I understand from the Neijing that was how they sort of assessed that as well. So so from that sort of goal, I kind of want people to come with a completely empty plate. That's the idea. I don't want, if they've come and they've had 30 years experience in standardized sort of TCM field, I just forget all that stuff and sort of start fresh.
And how glitchy do you think that's going to be, David, for people who are well established in a particular modality? Because you kind of sometimes you're asking people to crumble castles that they've spent years and years building. If you're really going to shatter their perception of how they've been treating, do you anticipate that that's going to be difficult for people?
No, I mean, it will be for some. It depends on how stubborn they are within their own practice. But one of the things, it goes back to what you said before, is that that what they've been doing anyway will have some basis or link within the Neijing anyway. So there'll be components of what we're studying that they're going to instantly recognize, and some of it will be very familiar. But now it's going to be a different sort of perspective and view and take and approach assigned to it. Okay. So I think from that, it's not going to completely crumble their perspective. It's more, I suppose it's the terminology and, like I said, that lens that we sort of develop is often quite radically different. But I may have been sort of doing this for 2 decades or so, but I'm still quite young. So the majority of people I've been teaching, over the last 20 years or so, or 16 years with particularly this sort of material, they've all been essentially older than me anyway and practicing for some time as well. And, I currently have, sort of mentorship program study group called Lingshu Labs. And many of the people in there have decades of experience and ideals, and they're very seasoned practitioners. And they're benefiting greatly from just that sort of approach to the text that sort of my lineage brings.
Yeah, okay. And so in terms of the way we've organized the course, what's the commitment? So we're going to meet once a month
So once a month for about 4 hours, for 20 months.
Yeah.
And then there will also be sort of support aspects within that as well. The goal was to give time in between so people can go and sort of sit with the material, sit with the text, look at the sort of the principles and the structures that I'll be teaching. Like in the first session, for instance, we talk about sort of textual scaffolding, the structure of the text. We look at like physiological structures, treatment structures, pathological structures, things like that within the Lingshu Jing. And then they can go and actually start reading it, sit with the book again, or for the first time, and start to actually see those structures and how they are manifest within the sort of unique way the Lingshu is presented. But so 4 hours of actual lecture time a month. And then there'll be a forum set up in regards for students to come on with generalized questions and queries and things like that. And then we're going to have the 2 Q&A sessions per part. So if it's 3 parts, 2 Q&A sessions for that, where either students can bring specific questions, or I may bring such things as like case study analysis and those sorts of things to those, just so we can start to more casually discuss the actual material that we're delving into. And then on top of that, the practical weekends, where it's sort of to bring it to live, which is going to be the 2 days in the UK, where first practical weekend will be working on pulse palpation and diagnostics. The second one will be on sort of needling techniques, and the third one will be a mixture of bringing it all together and more sort of advanced methods as we go through it.
Okay. And, I was looking at the course descriptor, the course descriptors are on the ICOM website, but I was just wondering how you go about teaching a concept like the Renyin Sumko pulse online. How do you teach pulses online? How
Yeah.
do you teach needle technique online?
Yeah, absolutely. Well, I mean, that's why we're going to have the prac as well, because so it's not 100% online. But you know, the actual act of feeling the pulse is one thing,
Mm.
but to have the complete sort of theoretical basis as to why you're doing it and what you're actually trying to feel for is another. Now, what's important is that, as I mentioned, there's sort of three primary pulse methods.
Mhm.
And the theory and the reasoning behind each of those pulse methods is really important, that each student understands that before going into just palpation or pulse calibration, with myself.
Yeah.
Renyin Trenko is an interesting one because the actual method of it is not that hard. The theory of it is a little bit more complex. So actually, the sitting there listening to me talk about it is actually more important than the observation of palpation. Obviously, both have equal importance in the end, but so those practical elements put into online theoretical discussion, I think is a real sort of cornerstone of how we need to approach all studies in Chinese medicine. I've never been a huge fan of online study, but I must say it's changed so dramatically in the last couple of years
Yeah.
that it's kind of become a norm, and I'm now quite comfortable with it, in doing those sorts of things. Um, I taught at university for 20 years, um, I was very much a practical, hands-on sort of teacher. So it was a big change for me. But I find with this material, it's nice just to be able to, you have the chapters there. Like I said, you might be a bit confused by them, having that clarity sort of laid out for you, going back to the chapters, spending time with it. And then once we go to do practical sessions on it, it just falls into place so
Yeah, okay.
smoothly.
Because you've done the prep work, you've done the kind of preliminary reading.
That's right. That's right.
So what
And I
kind
would say
of
that,
so what kind of
just to talk
yeah,
on the prac aspect as
yeah.
well, the needling techniques, the theory behind needling techniques, and like I said, reverse engineering the understanding of pathology associated with those techniques. That is so important to have that sort of already sort of embodied
Yeah.
in your being as a practitioner. Again, that they will come naturally as we start to go through aspects of needling, and yeah, that just it makes it clearer every time.
So as in, we prime the theory, so you have all the intellectual, and then it's much easier for it to drop into a kind of felt experience when we do the practical sessions.
Yeah, absolutely, absolutely. And I mean the difficulties will come with, the fact that I will needle a certain way that someone else it'll be different to someone else and so forth. But that's just the nature of doing those sort of practice. And the idea of teaching something with that principled structured basis or classical basis to it is that they will, yes, they may go, okay, I'm going to work on the INR's sort of approach to acupuncture, but they will still develop their system within it.
Yeah.
Again, it's like teaching martial arts. Martial arts, you teach those bases, and you teach those systems or styles and movements, but ultimately that individual will turn it into their system and style
Yeah.
in the long run.
Yeah, right. And so what kind of experience of pulse taking do students need to have prior to enrollment? I mean, there are
So
clinicians out there who don't know very or are not confident in engaging
yeah,
pulse.
I think if you have absolute minimal experience in it, again, you'll still the goal is that yes, you'll still benefit from this, and the goal is that you'll have this material and be able to return to this material as you develop your own understanding of pulse. So it will never be taught in vain in that way or learned in vain in that way, but there are some absolute basics in regards to what it's like to feel a pulse will help. But in terms of the positioning of the pulses, in terms of the qualities that we're going to discuss, they are so specific to the Neijing that they're not really going to be something that they would see in a standardized TCM course or even within something that is based within the Nanjing or Meijing. It's going to be very much Neijing focused.
Yeah. As
When
long
I
as you have
teach,
experience in kind of palpatory subtlety, then you
yeah,
can.
well, yeah, yeah. Well, at least you know that when we're talking about feeling the pulse at the wrist, where the radial pulse is at the wrist. I mean, that's what helps. But we're going to talk about positioning anyway, because, basically we talk, like I said, three systems. One is the Renyi Trenko, as we mentioned. One is just at the wrist, the Maiko or Trenko, if you want to call it that, or Chiko is the other term used in the Neijing. And what we look at is sort of the anatomical model as presented in that. But then further from there, we go into specific pulse qualities. And there's only a handful of pulse qualities in the Ling Shu that we work with that extend to every other aspect of quality. So it's not that we're keeping it simple, it's just that it's so clearly defined in the text that once you see it, and particularly I hope in the way that I'm presenting it, once you see it, it just becomes so clearly defined in your own clinical practice or study as well. So to me, it will make it more straightforward whether you're a beginner or whether you're very advanced in pulse diagnosis, or if you're extremely advanced in pulse diagnosis in another system. We're going to be talking about two other completely, unique systems to the Neijing. Sanbu Joho is the other one, which I use extensively within my practice. And go from there.
Okay. And in terms of the entry requirements for participants, who's eligible? Could a second year acupuncture student join as well as a seasoned clinician?
Yeah, so I mean, in light of what we're just talking about, a second year acupuncture student, it would be more than welcome. They will experience it differently. They'll have a different take on what I'm teaching. Again, the idea and the way that I'm running the Institute of Neijing Research is that if you are a student of mine, if you've taken a course, you've got access to me for the remainder of your or of my practicing life, so you or whoever dies first, but you've got that access there. That, I mean, if you're working with that material and you go, I'm a little bit lost, then you're able to revisit that material and have support with that anyway. When I was in London a year and a half ago or so, and I was teaching those Neijing needling techniques, we had some absolutely brand new students to acupuncture, and some who were on the cusp of sort of thinking about acupuncture, who'd come along and enjoy it. Now, some of them had not had much needling experience, and then I had really seasoned practitioners who were phenomenal needlers, and they both, developed a different understanding for their level as we went through that. So it'll be the same with this course, that you'll take away a little bit differently. You'll then approach and read the text a little bit differently, and you'll build on that sort of material as time goes by. And that's why also it's nice to have that break in between each session, just
for
to build
assimilation.
on it.
And so in regard to that break, do you have an expectation of the amount of study that people should be kind of doing between sessions?
Yeah. This is something that has been asked of me a few times, and the goal is not to bombard people with tons of papers and things like that they need to read through. I will give references to different texts and things as we go through it. Mainly in regards to reading, it'll be either working through the notes that I give, but then also mainly working through the text. So the text will be our reference point. So students can, to an extent, take it at their own sort of leisurely pace in that way. I'm not trying to create an added stress of study with this course. The idea is and I don't want it just to be a sort of side supplement course either. The idea is we just want to build this material and build this understanding in a nice sort of well-structured format that just allows people to move at their own pace within it. So it's not developed to be like a university lecture where you have your book of reading materials and those things. Our reading materials will be the text, and we will jump back and forth within that. And the Ling Shu Jing particularly, I mean, that's where our focus will be, but the Neijing particularly anyway, is a book, if the interest is there, you will be going back and forth to those same chapters for the rest of your life.
Yeah.
So, the reading materials as much as you want to read it.
Yeah. And is that kind of Unschul's translation is the one that you would use as a kind of standard?
We'll be working from some of my translations, and then Unschuld will be the base because it's the most easily accessible one. And so in regards to, if we're referring to a particular line, the page references will be used from Unschuld's translation for the Ling Shu, for the whole entire Neijing. But in the notes and those sorts of things, there'll be aspects of it which are just my own translations or translations of colleagues that I've worked with.
Yeah, okay.
Yeah.
Sounds super exciting. I'm really excited for it.
Yeah, I think it's going to be. I think it's going to be a great course, and particularly, I mean, the first part is something I've taught quite a lot. The second and third part is what I'm really excited about, because we go so deep into the pathophysiology and treatment of the channel system in quite a unique way of how I've sort of designed this. And for most people, for people who have studied with me before, who are coming to sort of redo some of that material, they've only done a short part of it. So we're going to go deeper and deeper and deeper into it. And I'm reformatting everything from what I've taught in the past, because I want it to fit so nicely within those sort of monthly lectures and the development of that. So I'm very excited about that particular aspect of it, because we're going to really look at unique approaches to diseases as represented in the Neijing for modern day clinic, and it's going to be invaluable material for any practitioner.
And do you find, David, that this kind of classical approach can accommodate some of the pathology that we suffer from now that wasn't present a couple of thousand years ago? Like
Absolutely.
nervous exhaustion, all the kind of neurosis that we suffer from now.
Yeah.
That wasn't
Absolutely. I mean, my clinic is primarily, sort of complex chronic diseases, and with a huge portion of that being neurological disorders as well. I mean, I see everything, but that's where their focus has been. Yeah, absolutely. I mean, the diseases that we see today, ultimately they're just names, but what we're looking for is patterning within symptomology and patterning within, various presentations. And once you bring to life and bring to practice, again, that sort of that Neijing lens of clinical practice, and particularly the clinical aspect, there's a lot of flowery discussion with the Neijing that's gone on for many, many years in sort of the current era of Chinese medicine. So much of it just doesn't have that clinical basis to it, and that is what I'm really bringing to this course, because that's what I do. That's what my teacher, Dr. Tai, he's near 60 years of clinical practice, and my 20 measly years as well. It's the idea is that there's a ton of clinical basis for what we're working on, but that's my focus is clinical work. The theoretical, like I said, flowery or esoteric discussions of the Neijing, which I find fascinating, are not a big portion of what I want to delve into in this course. I want people to take away really sort of core clinical techniques and experience it that way.
That they can bring it straight into their clinic and
straight into clinic, and then you can build on it from there as well. But I just want it to be, the focus is going to be, how can we apply so much of that text and this medicine.
Yeah. And then presumably if we come up with super interesting cases as we go through the course, we can bring those to the labs and the forums for discussion, so we can kind of qualify our understanding and what we think we've got from it.
I'll encourage cases to be either sent through, so I can break down what people are doing from this perspective, and like I said, I'll present some of my own. I think case analysis is a very important part of it. When we were designing this sort of course and initially with the 20 months, it could have easily blown out to a 5-year course, very simply. And after this, in terms of future study with it, there's so much advanced study within the particular disease chapters.
We can continue rolling.
And then you go into further theoretical discussions and larger practical discussions, and all these aspects of it as well, which I don't teach. I would get someone else to teach that, or refer them to someone else to teach that.
Yeah, right.
Yeah.
I mean, primarily that's what I'm looking forward to as well, is that there's going to be this community of practice of clinicians of very experience that we travel together through this exploration and share.
Yeah. Well, that's something that sort of I've been working and developing on, and even though I'm in Australia, particularly in the UK and particularly in London, is that there's quite a solid committed group there, which is great. And then I have a large number of students sort of scattered elsewhere around the world. And what it's going to do is start to bring all those together, and they'll realize that community is there and it's quite strong. And and so as we sort of move through this.
Do you know what? And I think there's a whole bunch of us who are looking for a home. Do you know what I mean? Looking for a home of,
Yeah,
some community of practice or community of study that we can be a part of.
yeah.
That
I
is
think that's
deep.
why Chinese medicine, continuing education is so popular, is because people are constantly searching.
Yeah.
And I think it's sometimes hard to settle down. There's searching, and then there's sitting, and there's um, loyalty to teachers, all that sort of stuff as well. But you have to find what works for you and what resonates with you as a practice.
Yeah.
And that's again why I love the Neijing, is that it doesn't matter what you're doing in regards to any other practice, it will somehow be linked back to this. So if you don't resonate with the Neijing or this material, then I think you're in the wrong profession.
Yeah,
Yeah.
right. Exactly. So look, that's super exciting. And if people are interested, they can check out the detailed course description on ICOM's website. And then, yeah, before we sign off, anything else that you think we should share with prospective signups?
No, I think the my website, also the Institute of Neijing Research.com, the ICOM website outlining the course. There's a ton of material there. I think if you want to learn more about what I mean by sort of the structure, the ICOM YouTube video principal practice that I did outlines a lot of that quite clearly. And
You also did
we
an article for EJOM recently as well, which was very much in
For
the
the JCM,
JCM,
General Practice Medicine.
yeah.
Yeah, so I did actually. There's a article I did earlier on Rennie Chen Cole, which will be a reference article for the course, so that's worthwhile reading through. And then one recently, which was just on tendon needling technique. So worthwhile having a read of that in regards to sort of aspects of sort of the approach within the clinical aspect of the Ling Shu Jing as well. Yeah. And I recently had a chat to Michael Max for the geological podcast
Okay.
as well. And which was seemed quite interesting. I think I was interesting on it. I don't know. Could have been all dribble.
Well, we'll get the links put up at the end of this video so people can explore further if they're interested. But,
Sure. No
yeah.
worries. And anyone's welcome to reach out to me, to send me an email. Email's info@instituteofneijingresearch.com if they have particular questions or concerns or anything regarding the course. But otherwise, it's just good Neijing material for your clinic.
Yeah, great. Listen,
Wonderful.
David, thanks so much for taking the time. Hey,
Thanks, Tom. Appreciate it.
yeah, great. It's been really nice to catch up with you, and I'm really looking forward to the start of the course in February.
Me too. Me too. I think we're going to have a really solid group, so it's
Yeah,
going to be great.
likewise, it is going to be awesome. All right, great.
Thank you.
Okay.